September is Prostate Cancer Awareness Month, and the fact is that prostate cancer is the second leading cause of death in American men after lung cancer. Joining me today to talk about this and the importance of the right kind of testing and treatment is Dr. Mark Edney. Mark, thank you so much for joining us today.
Thanks for having me.
So I first want to talk about getting testing, and it's what's really key here is you're talking about the right way to do testing. Let's dive right in and explain what you mean by that.
So among the treatment options for prostate cancer, which can range from surgery to radiation to freezing it or cryotherapy, an important option is what's called active surveillance. And so once a man's been diagnosed, and that's a tissue biopsy, assessments are made of the biopsy sample, and where this new testing comes into play, this is genetic testing. And so the Polaris genetic test is a test that can be applied looking at the genes of the prostate cancer on the biopsy sample to determine levels of aggressiveness. And so based on the genes, we could get a report back that says this prostate cancer is less aggressive looking, and it may be appropriate and safe to watch it rather than to barge into treatment. We can also get the other kind of report that says, based on the genes, this genetic test called Polaris, the cells look more aggressive, and we really should launch right into therapy right away. So that's the critical decision that this test helps with, and helps men with achieve greater confidence in making that decision.
Because in reading and getting ready to talk with you, it seems like over-treatment of prostate cancer is a real problem right now, right?
It is a real problem. So upwards of 90% of men who are newly diagnosed with prostate cancer end up getting a treatment of some form or another. And based on what we know about how prostate cancer behaves, it's estimated that about 50% of men probably actually need to be treated. So upwards of 40 or 50% of men are what are called overtreated. And it sounds like a bad word, and it sounds like there are bad things going on. It's not. We overtreat by necessity because until now we haven't had specific enough information to separate out the low risk and the high risk prostate cancers. So we've had to err on the side of treating most men to make sure we get all the aggressive cancers. And what this genetic test, this Polaris genetic test, is allowing us to do is to, with greater confidence, separate out those low-risk men that can safely be watched and save treatment for men who have the genetic profiles that actually need treatment. So when we're able to do that, we're able to reduce the overtreatment of prostate cancer and really save treatment for the men that need it and provide confidence and reassurance for the men who can safely be watched.
It seems like every day you read a study or you see a new breakthrough. What treatment options are you talking about when we do talk about prostate cancer?
So treatment can range from surgery to remove the prostate to radiation, which is delivered from outside the body, to freezing it. There are a whole host of what are called focal therapies that are also being investigated to treat just portions of the prostate. None of those are sort of prime time yet, but I think in the next few years we'll start to see focal therapies emerge. But those in general, the surgery and radiation are the treatments people will be most familiar with in terms of the active treatment of prostate cancer.
Well, I want to make sure and end talking about this testing. How are you able to use this in your practice, and what are some of the benefits that you've been able to see with your patients?
So I use this all the time. I diagnose about 1 man a week with prostate cancer, and I use this as a critical tool in all of my new diagnoses of prostate cancer, again, to help men make that critical decision based on the genes of the prostate cancer. Is it safe to watch your prostate cancer? Can we observe this closely? Or do you have a genetic pattern in your prostate cancer that suggests that we should jump in right away and treat it? And again, it provides men, the Polaris test, with tremendous confidence in making that decision either way, either to the decision that it's safe to watch, or based on the genetics that we really need to treat right away.
Okay, Dr. Edney, thank you so much for your time. And where can people go for more information?
So there's additional information. The American Association of Clinical Urologists website, aacuweb.org, has information, as does the Polaris.com website. That's the website for the test, Polaris.
Good stuff, and it's all right there on the bottom of your screen. Thank you again for your time. We appreciate it.